all the streams. So welcome. Hello, everyone, and welcome. I'm Aura Vasquez. Welcome to another week of Aura Vasquez virtual town halls. I created this space for us to learn about current issues, politics, and things that can educate us so that we can foster a better dialogue and also take action in our communities and in our personal lives. This is the second time, the second week that I'm hosting the Drug Policy Alliance, and I couldn't be more thrilled to have a panel of all women talking about harm reduction and legalization, cannabis, and other things that we're going to be discussing. Where we're going to be touching some topics that are really dear personally to my heart and to a lot of you. So please have your questions ready. Don't be shy, and we are very, very excited to see you today. So first, I want to welcome Janet Sanipatin from the Drug Policy Alliance. She is the very California State Director, and she's joining us both here on Facebook, YouTube, Twitter, and also here on Instagram. And for those of you that are watching on YouTube and that are also watching in other social media channels, I would like for you to help me welcome Steffanie Campos, and she is from the Homelessness Healthcare Center, and she's also going to be having a conversation with us. So for those of you that want to see the whole package and you are on Instagram, please join us on YouTube. You can go to the link in my bio or to any of my social media, but we have our stellar Janet here. So Janet, welcome. Yeah, I can hear you perfect. And for those of you out there, let us know if you can hear us fine. So I want to start first by asking you, how do you get to this work? And I want to also extend that question to Steffanie. Janet, can you unmute your computer volume, because people on Facebook cannot hear you? The same with you, Steffanie. I think you also muted. I believe so. Okay. Let us know, friends, if you can hear us. If you can hear us, let us know. Okay. Let us know if you can hear us. Please put a little heart on the comments. Janet, I think you're still muted. And on Instagram, I can hear you perfect, but not on Facebook. Let me see if I can unmute you myself. No. I cannot unmute you. You have to unmute yourself. You're still muted. Yeah. It's your computer. I think it's on the StreamYard. If you can see the little icon to unmute your mic.
Okay. Is that better? Okay, yay, we got it to work. Sorry, no, just too many buttons to deal with.
No worries.
So sorry, I apologize. So yeah, I got into this work. I'm an immigration attorney by background, but got into policy work several years ago, wanting to work on immigrant rights issues. And then about 5 or 6 years ago, I got a call from Drug Policy while I was at MALDEF, and they asked me to work with them on a pair of bills having to do with drug diversion programs for non-citizens. And so that's how I got connected with DPA and subsequently landed here in LA and contacted my friends at DPA to see if there are any job openings, and they had an opening for a director, and I sort of fell into this work that way. But I've always been very interested in drug policy, criminal justice reform, and anything that really touches, immigrants and Latinos. So the work that I'm doing right now has that intersection, which I really love and enjoy, and it's, making me grow professionally in ways that I never anticipated. So harm reduction, pure drug policy is really new for me. So
Wow.
that's how I landed here.
It's also great to have another, you as a Latina, myself, and we'll get Steffanie in just a minute to share a little bit about how she got to this work. Because when I started supporting Prop 64 and legalizing and decriminalizing cannabis, I was one of the very few people, very few Latinas that kind of wanted to support this type of work. There's great stigma in our community. So it's great to have you and all of your experience. Thank you so much for joining us today. Steffanie, how did you get to this work?
Hi, hopefully you can hear me okay.
We can hear you.
Good. Thank you so much. Such an honor to join both of you, fellow Latinas, here on the panel and speak about the work that we do in the communities. So I have always been drawn to kind of the public sector or nonprofit. And when I moved out to Los Angeles, the city where I live now, 6 years ago, that was the first time I really saw homelessness. I grew up in a suburb outside of LA, to immigrant parents. I'm first generation, and it was kind of a little bit of a bubble. So when I was learning about different issues in our societies in my master's program, I learned about Homeless Healthcare LA and what the organization does. And that's when I became very attracted to the work that they do on the harm reduction end and across all our programs. So when I first moved out here, I really saw it, it's so in your face and it's so visible and present. And it's just increased over the last few years. And the first person I met, actually, her name was Steffanie as well. And she lived in her car right where I parked my car. So I really got to know her on a personal level and engage and have those communications. And I think that's what makes the biggest difference, right? Is just, people's fears is such a barrier. So if you really get to know the people in your community or talk to your unhoused neighbors, it would make all the difference. So that's where I was really drawn to this work, and have been here 5 years now at Homeless Healthcare LA.
Amazing. Thank you so much for joining us today and for sharing your experience and also all of your knowledge around this, this very interesting and also kind of nebulous topic. And I wanted just to first start, Jeanette, with you, and you also feel free to chime in, Steffanie. What is harm reduction? I think that throughout this week that I have been talking about harm reduction, there was a lot of gray area. People didn't really understand. So how do we define, or how do you define harm reduction, and how can we educate people, the people watching about harm reduction?
Yeah, so harm reduction is really just a set of practical strategies and ideas to reduce some of the negative consequences that are associated with drug use, right? Harm reduction is really a movement built around social justice and really built around the belief that people who use drugs have the right to be respected, and that we really need to meet individuals where they're at. So for example, if you are a homeless drug user, you really should have access to things like access to healthcare, access to things like wound care, and then you should also be able to get information about your drug use and mitigate whatever harms to the extent that they can be mitigated through this whole idea around harm reduction. It's really built around the idea that folks are going to use illicit drugs just like they're going to use alcohol. And I kind of liken this to sort of how we treat someone who is an alcoholic, right? They're going to want to get help when they're ready. And so harm reduction really respects that in individuals. It's not really forced or coerced. It's really just building trust with individuals, looking at drug use more as a public health issue and a public health matter, and really providing those services to individuals that need them. And so it could be a whole array of services. It's not just one thing that you could isolate around harm reduction. So most people might be more familiar with syringe exchange programs where folks can go in and get, clean syringes, get clean supplies. You can even get fentanyl testing strips, for example. and check your supply and make sure that there's no fentanyl or anything that's lethal in whatever it is you're using. And so, like I said, just going back to what I originally said, it's really just meeting people where they're at and providing them with those services, and really just respecting individuals' dignity and rights, because people who use drugs, definitely deserve our dignity and deserve to have their dignity preserved, as well as ensuring that they're treated just like everybody else.
Thank you. And Steffanie, for you that work directly with the unhoused community, can you share what is harm reduction and how that is a part of your program also in your organization?
Yeah, absolutely. I think Jeanette summed it up perfectly in terms of an overview of what harm reduction means. So, for us, it's a person-centered approach that seeks to reduce the social, health, and structural harms associated with substance use, as well as healthcare. We've been practicing harm reduction since its fruition over 30 years ago. It's our guiding principle, really. And it's a commitment to supporting the dignity and respect of people who use substances. So our programs are client-driven, meaning that we listen to our clients and we take their feedback, and they're part of the program implementation process. We make sure that all of our programs are as low threshold as possible, and everything we do is through a non-judgmental lens. So programmatically, some examples are that we operate a syringe exchange. So Jeanette was describing kind of what that would look like, providing sterile syringes, safe for injection supplies, fentanyl testing strips. We also recently established a low threshold drop-in center inside of that site, and it's the first and only community center and drop-in access point designed specifically for people who use substances experiencing homelessness within Skid Row. So we're super excited to be able to do that. And then I oversee the Refresh spot. It's also in Skid Row. It's a hygiene center that does not have any sort of discrimination or barriers for entry. So it's very high volume. We see over 800 intakes every day out of that site because of the way it's designed programmatically. Nearly all of the 50 full-time hires to operate the site have lived experience, which is important to try to provide that workforce development community into the programs you're doing. So they're all designed to be non-punitive and destigmatizing, to serve as a firm counter to the social marginalization produced by decades worth of failed drug policies. Those are a few of the programs that are probably the most low threshold that we operate and practice harm reduction like at its very, very core.
Got it. And as someone that, I personally believe that drugs should be legal. I firmly believe in the idea of harm reduction, simply because I think that people are gonna do drugs. We for far too long have been treating drug addiction as a crime and not as a disease. And we should be in the business of saving lives and helping people be, better and healthy. So my question is, how can we use this model to make sure that people have, have the opportunity to be healthy, and then we also remove the stigma around, drug use and drug abuse and addiction? Because I feel that, and I can see it, some of it in the comments here on Instagram and in other places, where people are already saying, oh, are we going to make it more comfortable for people to get loaded? And I don't think that's the case. So can you speak a little bit about more of the scientific, the health part of it, the public health, and how can this help us be a better society instead of maybe increasing more homelessness and increasing more drug addiction in our communities?
Yeah, I don't know if it's for me or Steffanie, but I think for DPA's perspective, I think it's really important to understand that, there are definitely public health issues associated with drug use, right? There's the concern about communicable diseases, and so it's very important for drug users to have safe supplies to syringes and other things that are critical for them to maintain a healthy lifestyle. And what a lot of harm reduction organizations provide is just that, right? It just provides, individuals with much needed supplies that maybe they wouldn't have access to otherwise. And it does help us maintain and ensure that from a public health perspective, folks are staying healthy as possible. The fact remains is that people are going to use drugs, and why not ensure that they're using drugs in a way that's safe and healthy for all of us,
Mm-hmm.
and especially right now during the pandemic. I think a lot of folks, have overlooked sort of what this pandemic has done to individuals, especially like in places in LA where, we immediately went into shelter in place, and a lot of harm reduction organizations throughout the state actually continued to provide services, street level services to individuals. And a lot of our homeless folks, a lot of our folks that were drug users had no idea what was happening with COVID-19. And, these harm reduction groups and organizations were frontline workers, essential workers in the midst of the pandemic when everybody else had to close down their brick and mortar places. Harm reduction organizations really stepped up and provided access to hygiene kits for folks that were homeless, provided information and education around COVID-19, and even access to COVID-19 testing. And when we think of the pandemic as well, the other piece is that, harm reduction organizations and groups like HHCLA are able to provide a clinical healthcare setting for
Mm-hmm.
folks without the stigma, right? Because otherwise, individuals really do feel stigmatized going into just any normal brick and mortar healthcare settings. But harm reduction organizations really work hard to remove that stigma so that folks could get quality care as needed.
Thank you for sharing that. And some folks are, I don't know, Steffanie, if you want to chime in anything regarding these questions around, the stigma.
Sure. So I do see a question here asking about if we've seen an increase in fentanyl being used in combination with other substances. So that is something we've been seeing just in general, the increase of fentanyl and opioids being used in conjunction, especially in Skid Row and then across LA. And in terms of the purposes of fentanyl strips, the idea is for people to know if their substances do have any amounts of fentanyl, and we typically educate our clients on how to use the test strips. So if they are using the test strips before they actually use, it helps them maybe change so they don't use as much or do a test shot. I was actually looking at our overdose rates report that we have every month out of our syringe exchange, and it was showing that all of the clients that did use the fentanyl strips were testing their supplies before injecting or before using, which is kind of what we advise to do as opposed to after. It's good to know either way, but we would rather have them test it prior to using, just so they know and can be, move forward a little bit safer accordingly.
Thank you. And I guess I want to just return to the topic of what are some of the nuances that are happening right now with harm reduction, maybe some of the programs that you're working on, Janet, and the Drug Policy Alliance, and I guess they, apply to other places and other organizations. So if you can share with us what are some of the nuances of harm reduction today, what policies, programs, education we're developing so that we can make harm reduction more acceptable in our society and more accessible as well.
Yeah, well, at DPA, we are not only a state organization, but we're a national and international organization. And a couple of things that we've been working on has been, for example, our Safety First curriculum, which is a curriculum that's geared towards teenagers and high school students to really just have an honest education about what drugs really are and what they do and what are the principles of harm reduction, right? It's all about honest conversations and education about substance use. I grew up when we were just saying no to drugs, and that was just really was lacking on so many levels from a cultural perspective, from a real day-to-day perspective about, what are the harms associated with drugs, or how do we educate our youth around drugs? So DPA really took a leap of faith, created this amazing curriculum that we've been using in different places throughout the country to just have these honest conversations with our children. I have a 13-year-old and a 16-year-old, and one of the first questions I asked myself about before I took this job was, can I take this job and still be a mom and still talk about these issues and then have these conversations with my children? And I can, I'm able to have these honest conversations with my kids. And I think it's really important for people to understand that it's really about education, and especially from a Latino perspective.
Yeah.
We have to demystify the whole issue around drug use. Our community tends to just label folks about, ese marihuano, ese drogadito, but not really understanding like why people are turning to substances, or how can we help them if help is really what folks are asking for. And so I think it's a matter of just educating our youth, our community, our family members about some of these issues, and for Latinos, drug use is a big taboo issue, but I think it's a really important conversation. I've actually been surprised in my family. A lot of my family members really are in favor of decriminalization. And at first I was like, I'm not going to tell any of my tias or anybody that's, a generation above me about the work that I do, because I just can imagine what they're going to say. But I've been, shockingly surprised, especially because my family comes from all over Latin America. My family is primarily from Ecuador and El Salvador, and, they've been hit pretty hard by the war on drugs. And so just having an open conversation, I think, is really important. The other pieces that DPA has been working on has been around this whole issue around safe consumption sites. They're also known as overdose prevention centers. We had a bill here in California to authorize a safe consumption site, which is really a place where someone can go in, use their pre-obtained drugs under medical supervision. The whole point of these centers is really to prevent overdoses, but also, again, remove the stigma of drug use, give folks access to a healthcare setting, give them access to critical services that they need. And then when the individual is ready, when that trust has already been established, we can refer those individuals to counseling, mental health, or drug treatment if that's what they choose to do. And these centers really serve as a one-stop shop for individuals. In California, we're so famous about using one-stop shops for like enrolling, for example, kids that are on free lunch programs into Medi-Cal, right? And so if you think about safe consumption centers, it's sort of the same idea. It's once you get the person through the door, you can provide them with all the services that they're eligible for, and really just build that trust to get them to either to be safer in their drug use or to seek treatment if that's really what they want to do.
Thank you for that. And I think you touched a couple of points, and folks in the comments have been also mentioning this. The war on drugs have been a failure. I personally was very affected by the war on drugs in my own country in Colombia. A big reason why we came here was escaping the violence that the war on drugs brought. It doesn't address the issue of consumption in this country, which is, there's demand and there is supply. And in the first week of conversations with the Drug Policy Alliance, we talked about that. But it also criminalizes mostly people of color, Black and brown communities, because we're already targeted by police because of racial issues and systemic issues that are, inherent in our police force, and in the idea that, los marihuanos and all of the stigma, and also just the classification that we have got together, that the fact that we are the ones, people of color, Black and brown people, end up in jail at a higher rate than white people, where, I don't have the data right here in front of me, but white people oftentimes consume more of certain drugs than other, communities. So my question for Steffanie is, you work with our unsheltered community, our unhoused. How do you see these programs, education programs, project policies, like working, since you are like front line working with homeless folks in Los Angeles? So how do you see these policies and this educational part, and like reducing the stigma and making it harm reduction more accessible, beneficial for the community that you serve?
Right. I think there's such a long ways to go on that end to continue the education and reducing the stigma. When people ask me, I get this question all the time, like, what's the hardest thing about your job or about working in the homelessness field? And the hardest thing is it's the stigma that we have to see. It's so prevalent among people who use substances, among people that are unhoused. And even when we're trying to develop shelters or develop housing projects, the community, there's so much pushback. So it's just like an uphill battle. And that is something we're trying to do is create housing. And it's just always the NIMBYs, not in my backyard. It's not that they will protest or there's so much pushback. People all want housing. They just don't really want to see it on their streets or want it in their communities, which is unfortunate because it's prevalent everywhere here. I will note, though, in terms of the policy end of things, I was referencing the Refresh Spot earlier, which is a program I run here. That's funded out of Mayor Garcetti's office. So we're happy to have them as a partner. But I was saying before, the work is just so vast. The numbers keep increasing, especially within Skid Row and then just across. It's very visible in LA, at least. And then in other parts of the country, of course, it's an increasing issue. With the pandemic happening now, the numbers are reportedly projected to be even higher than we had anticipated prior because of that. So that's something we have to keep in mind and kind of prepare for and continue our campaign about battling the stigma. We have DPA as a partner, and we're happy to advocate with them. And we have been advocating for Assembly Bill 362 that Jeanette referenced about sanctioning these overdose prevention sites in certain jurisdictions for California. And we actually also partnered with a group called the Men's Home. They're based in Copenhagen, and they run the world's largest drug consumption site. It's called H17, and we've partnered with them for years. And they come work over here. We go over there. I'm supposed to be there now, but that got canceled because of COVID. They really provide that technical assistance and knowledge that know how to operate these sites. So we're glad to have them as a partner. And we just hope that we can, run one of these sooner than later because the need is there. They've been around in other parts of the world for decades and have shown to there hasn't been a single fatality in terms of overdoses at any of them, and there's no syringe kind of debris around. They don't increase crime in the area. So I think that's kind of a lot of the stigma and fear people have, and they decrease and this goes along also with needle exchanges. They decrease HIV rates, HCV rates, other communicable diseases. So there is that public health component is there. And it saves on public dollars in terms of the legal system and hospital visits. So it's just super, we're super ready for it here. So
of course,
a lot of work to do.
I'm having a question here on Instagram and I don't see the full question. But it's something around when you have a family member that lives in the street, how can you admit him to recover or even introduce the conversation of like, hey, if you are having a drug addiction and you're struggling getting sober, you can go to a center where there's offer harm reduction. So how can someone have that conversation with someone that is living on the street, or what are some of the things that family members can do to help them through harm reduction to start thinking about a more long-term recovery?
So on a broader scale, the sad reality is there really aren't enough residential treatment options locally here. So it's very limited. There's always a wait. People typically tend to prefer residential. We offer outpatient substance use treatment. MAT is one of the programs and services we offer. It stands for Medication for Assisted Treatment. It's basically a drug replacement therapy that allows people to utilize this prescription drug, and then it lets them wean off their opioid use. And so we do that right out of our syringe exchange. And it's not residential. However, there's a lot of people that are very interested in doing it. and going through that induction phase and then the maintenance component to follow. So I think historically the way methadone was stigmatized and continues to be, I think MAT is it's made a lot of strides towards not being as stigmatized, and it's now being more accepted and more broadly accepted. And, when we offer our services to our clients, we let them know that this is just one of an array of kind of what they're looking to do. So it's not just like, oh, abstinence is the only goal we have. I mean, that if people want to, that's their goal, that's wonderful. But we understand, within our treatments and our services that it's whatever the clients are looking for. And we want to just guide them and help them get to whatever their goal is, what they determine it to be. So with Matt, it's proven to be successful for a lot of people. It's kind of dependent on what people are looking to do, and also if they're ready to do that, because we all know that, pushing people into treatment or treatment does not work. It just doesn't work that way, or else things would be very different if they did.
It's a struggle. Some folks on the comments are mentioning things like we need to just legalize drugs, because also prescription drugs, for example, which is not what we're talking about here. We're talking about illicit drugs, kill lots of people too, and they're prescribed by doctors and they're legal. So the Drug Policy Alliance, where in your campaigns are we working towards a world where we're going to have one day programs like in places like Amsterdam and in other places in the Netherlands, where drugs are basically legal and you just make it easy and you treat people that have drug addiction as people with a disease, not with a crime?
Yeah, so Drug Policy Alliance is definitely looking at decriminalization efforts. We're looking at, for example, in Oregon right now, we have an initiative on the ballot. It's Initiative 40 that is going to be voted on this November to decriminalize drugs in Oregon. And one of the primary focal points of this initiative is to really, shift the conversation and take folks out of the criminal justice system and center them squarely within the harm reduction space, right? To provide folks with wraparound services, to get an assessment, to get into treatment if that's what they choose to do. And so it really does shift the conversation when we talk about decriminalization, because what we're really saying is we really need to stop treating drug addiction as a criminal justice matter and really look at it from a public health perspective. Drug addiction, substance use addiction is really more about, it's really about a public health issue. And so how do we treat folks without the stigma and really provide those services to individuals? What we're doing now just isn't working. The war on drugs has been a complete failure. As Aura mentioned earlier, Latinos, African Americans, Native Americans, we all tend to use drugs about the same rates as white people do, yet over 80% of the folks that are incarcerated because of drugs. And this is even in places like in San Francisco, that's supposedly very progressive, has, programs on the ground that are supposed to help divert folks from misdemeanor offenses and felony offenses. We still have folks getting arrested all the time in places like San Francisco and LA. So it's really critical to start looking at, what has mass incarceration done to our society and what role has the drug war played? It's played a huge role in it. And so when we talk about things like, decriminalization or defunding the police, for example, it's really a matter of shifting the conversation from the criminal justice system and looking at public health and harm reduction and providing those services. So, folks are having conversations around, how do we defund the police, or what does that look like? From our perspective, it looks like providing these types of services on the ground. As Steffanie mentioned, it's really hard because we don't have all the services that people need. But what we need to do is at least to provide basic access to folks, access to certain communities, so that they can, if they choose to get treatment, then they have those entry and those access points.
Absolutely. I don't know if you want to add anything to that, Steffanie.
Basic access. I think that you hit it on the head. And then just personally here, yes, I totally think that drugs should be legalized and regulated, just like everything else is to some degree. I feel very fortunate enough to work at an organization that echoes kind of my personal beliefs and that allows, staff members who want to protest. That's, they're fully supported in that capacity. They want to do advocacy work. That's great as well. And it comes from the top down. So we're going to continue to do that work.
Yeah. So we're a panel of women, and oftentimes we connect or associate drug abuse or addiction with men. But I know that this also affects and impacts women. So how does harm reduction impact women? And we often don't talk about this topic, but I would like to shine the light to also unhoused women. There's tons of unhoused families, in Los Angeles. So how is this also affecting specifically women?
So I'll just note that in terms of people that use substances, it's not the majority. It tend to be women globally or locally. So as a result, harm reduction services tend to serve more men because it just happened to be that way. And the broader determinants of women's health, poverty, mothering, violence, social policies, they're not accounted for always in the design of harm reduction strategies. So that really needs to be looked at and somehow find programs to implement and increase that, and do women-only spaces and do women-only hours, or it could mean separate facilities dedicated for serving women. There could be a gender balance among harm reduction staff, including active involvement of women who use substances in service provision to break down this barrier. And especially women who engage in sex work or become pregnant, it's crucial for women to be involved in leadership and decision-making within harm reduction organizations.
Yeah, I think from our perspective, definitely there hasn't been a true gendered approach to harm reduction. Just like there hasn't been a true racial equity approach either. I think in LA we're lucky that we have organizations that serve East LA, Skid Row, and South LA, but there are other places in our state that just really haven't tapped into either women or really serving marginalized communities like Latinos, Native Americans, and others. And so from a gender perspective, definitely, as Steffanie mentioned, there are other determinants of health that we have to look out for in terms of sexual violence, domestic violence, as well as reproductive justice issues and folks who are pregnant and are drug users, and how do you provide those services that are needed. We also partner with other organizations internationally, and I think they signed in on IG, but there is one harm reduction center in Mexicali that provides services just to women and transgendered folks, and they're actually a safe consumption site. And one of the things that they do is make sure that folks that go into their center have access to reproductive health care as well, but also just have a place where they could just take a break from being out on the street. I mean, imagine being a homeless woman or someone who is transgender and how much violence you're subjected to on a day-to-day basis. So just as, Steffanie mentioned their cooling off center, just having a space where people could provide some respite, could get together with other women and just have, just breathe for like an hour without being afraid about what's going to happen to them on the streets. I think it's really important. Not only do they provide healthcare services, but they also provide things that women need, like hygiene kits, access to feminine products, you name it. But this is a really important part of the harm reduction work, and that's why it's so important to have women and people of color in these spaces to really look at these, the way that we're delivering services and make sure that we're delivering services to very vulnerable, very marginalized folks on the ground, and the majority of those folks definitely that often get overlooked are women and people of color as well.
Wonderful. And I want to bring, especially because we see on the unhoused community, obviously women have more needs, different needs than unhoused males. And of course, we didn't get to talk to the LGBTQ community, which is even a more challenged community because they have also different needs and there's not a lot of resources for them. So somebody on YouTube was asking that harm reduction and the programs that you guys work with and support sound like what's happening in Amsterdam. A lot of us know that in Amsterdam, drugs are legal and they're regulated and they tax and it's fine. It actually lets people, die from drug use, and actually, I believe it has reduced the amount of folks that live on the streets. But is it possible? The question is it possible that we can help, that these type of programs can redevelop community and bring connection instead of bringing chaos? Because I think the idea that a lot of maybe viewers have, or people that eventually watch this show, they think, well, if we have a center like that in my street, in my neighborhood, all of the drug addicts are gonna come. They're gonna be hanging out. They're gonna, So the idea that it's gonna be chaotic and that is gonna bring in, that is gonna be unsafe, that is going to, that is going to bring drugs to your community. So how can we ensure that these or what is the idea that we can use harm reduction and actually bring more, redevelop our community, bring safety and just bring resources that actually can help a community that is struggling? So either of you can kick it off, whichever wants to start.
Yeah, I mean, I think I can start just with safe consumption sites, for example. There are 10 other countries in the world that have them, and the U.S. is still lagging way far behind all these other countries where they've implemented overdose prevention centers or safe consumption sites. As Steffanie mentioned, they have never lost a life, and so when you think about the implications of the opioid, the overdose crisis, yeah, and the number of folks that are going to be that are overdosing right now, and we don't have a response. And so all the studies that have looked at safe consumption sites demonstrate that crime is reduced when you open one of these centers up. But the first thing people think it's, oh my gosh, there's going to be so many people there. There's going to be dealers on every corner, wherever these buildings are or these centers are. But all the science, all the evidence, all the data demonstrates that crime is actually reduced in these communities. And but public health of that community is increased. I think it's really important to understand that before a lot of these centers open, they definitely have to work with the community and the different stakeholders in place to educate them about what services they're providing, what the community actually needs, and how the community can actually improve by having one of these centers in their neighborhood. And so there's a lot of work that needs to happen in terms of education, but also just having conversations with critical stakeholders and businesses wherever one of these centers are brought up to scale. And so I think we've learned that lesson. There was a safe consumption site that wanted to open in Philadelphia, and they just didn't, they weren't able to have those conversations. And so we saw that there was some backlash at that center in particular. And I know Steffanie has more insight into this as well.
Well, I have a couple thoughts. As you were asking the question, Auda and Jeanette, you were kind of chiming in. So it's important to note that these consumption sites around the world are not out in like industrial areas where there aren't people. They're in the downtown night areas. They're not isolated out, like, so they're embraced by the community or people probably may not even know it's there. If you were to look at pictures, it looks just like any other downtown. So I think it takes a community buy-in. Unfortunately, when we were creating drug laws in this country, we took the punitive approach as to where most of the places in Western Europe and in other parts where they have these, they looked at it like a public health concern and also like a medical concern and a need. So I think that that's kind of rooted in a lot of the mindsets, unfortunately, which is decades and decades in the making. So I think there needs to be a bit of a shift, which is like a big haul also. So my hope is for one to be sanctioned. Yes, there might be outcries, but I think in time people will see the benefits and see that it's not going to create chaos, and hopefully start that movement where more will come to fruition. And then, I think it's just going to be a little bit slow here in the U.S. just because of the mindset this kind of nation has when it comes to substance use.
Yeah, I mean, we already see a lot of the backlash even when we try to open shelters for our unhoused community. There's a huge stigma around that. So my hope is that as we grow and evolve, and even this pandemic that help us have some sort of introspection, that we start to understand that this problem is not getting any easier if we don't tackle it head on, and if we don't start changing the way we have not been treating drug abuse and in general drug policy in the best way. At some point we had alcohol, was prohibited too. And if anything, alcohol killed more people than anything else. I mean, from car accidents and such and other things. So I really hope that we having these conversations, and I'm going to have the Drug Policy Alliance again next week. I'm very excited about that. So we're going to continue the conversation, because my hope is that for the folks that are watching, that we're getting educated and we're planting a seed that needs to grow in all of us. And as young people, we're Latinos, we love dancing, music, it's much of in our culture. A lot of our young people go to parties, and it's sad to see that they don't have this space to perhaps explore in a safe way. And there are organizations like Dance Safe. If you don't know them, I encourage you to get to know them. They're wonderful. They sometimes are welcome in raves and in concerts and stuff like that. So if people are going to do drugs, they want to make sure that young people have a place where they can test their drugs, where they can be safe, where they know what they're taking. A lot of young people experiment with illicit drugs, and it's just sad to watch the way that they're introduced to that world, instead of being an experience where they can learn, grow, and move on, instead of having to have maybe a terrible experience or just stay there, which is not what we want. We want, our young people to be healthy and to be uplifted and supported. And that includes, you're a mom, Janet, so you can speak maybe a little more on this kind of maybe idea of how do we also include our young people in this harm reduction conversation at a young age.
Yeah, like I mentioned earlier, I think it's just important to have these honest conversations about drug use and what it is and what it does to you. I'd rather be more educated about it than not know anything about it, right? Because at least it gets demystified for me. And I think for young people, it's really important that they know that there are harm reduction strategies out there. There's amazing work that's being done on the ground. There's a lot of young people that are doing work in the harm reduction space that really look at it from a completely different perspective than even my generation looks at it. And so I think it's a matter of just educating folks on the ground. It's doing a cultural shift, especially for communities like our immigrant communities, our Latino communities, our Native communities. But then it's also a cultural shift for the US, right? We know that in the US, there's so much stigma around drug use, around who are drug users and who gets arrested. But the reality is, in order to really address issues of unhoused and homelessness and issues that we're facing right now around racial inequity in our country and around mass incarceration, we have to look at these issues with a really with a really keen perspective and understand the interconnectedness between all of this, right? There is the drug war was started to really control communities of color. When you look at incarceration rates in California in the last 50 years, 50 years ago, it was predominantly white folks that were in jail and in prisons. And now it's my community, both male and female are behind bars. And so, we need to have an honest conversation. We need to look at strategies that we know are tried and tested and can work, and just understand that what we're doing is not working. We have to do something else. There's a lot of moms have gotten into this movement because they lost children. And I've heard a lot of moms say, if only my daughter or son had access to a harm reduction organization or even a safe consumption site, they'd be alive today. And so we got to start honoring people's lives and their dignities and look at this from a completely different perspective.
Absolutely. Absolutely. We have just a few minutes, and I want to wrap up because I know Instagram definitely kicks us out after an hour. But I have one more question for you, and also just to wrap up, what is medical assistant treatment, and how is that part of harm reduction? So maybe we can take it very quickly. I don't know, Steffanie, you want to kick us off?
Sure. Yeah, I touched a little bit on MAT, medication for assisted treatment, earlier, because it is something that we offer. It's basically a whole patient approach to treat substance use disorders using counseling and behavioral therapies. So it relieves withdrawal symptoms and psychological cravings that cause chemical imbalances in the body, and provides a safe and controlled level of medication to help mitigate the use or longing for an opioid. In a nutshell. So that is what MAT is. I don't know if you want to add anything. And then also so what we use at our site is Suboxone, Subutex, buprenorphine. So if some of you may have heard those, that's MAT. So you can kind of connect those two.
Okay. Well, thank you so much for sharing. And what are some of the things, like how can people learn more about this topic? Where can they find you? How can they maybe join an advocacy effort that you might have to continue supporting more harm reduction programs in our community?
Steffanie, do you want to go first?
Sure. Sorry, I wasn't sure if it was. So more information is at hhcla.org. I would love to give out my contact information. Also, I chair the LA Overdose Prevention Task Force. So when Jeanette was speaking earlier about mothers who lost loved ones or a child, we have a lot of those mothers and parents coming into that group. And I just want to say that we're strong advocates of naloxone distribution. So if anyone ever needs any, we are happy to give it to you and train you on it. It reverses.
If you put the address and the information, I can put it in the comments so people can live there forever. Jeanette, how can we find more information about the Drug Policy Alliance, and how can we join your efforts and your campaigns?
Yeah, so we're at drugpolicy.org. Sign up for our newsletter. I'll put up my information as well. We do state level policy as well as local policy here in LA. We've been doing some really great work at the local level around harm reduction and pushing policies that we think are going to create this alternative system of incarceration, that really follows this whole care first, jails last model. And so we're in a lot of different spaces, but definitely welcome opportunities to work with everyone out there. And I just wanted to give a shout out to Steffanie too. We've been partnering up with HHCLA for about 1.5 years now, and it's a great partnership. And as you can see, Stephanie's a superstar out there. And so we just really appreciate being able to have this forum and share it with you, Auda, as well. Thank you so much for inviting us. This has been a wonderful opportunity.
Of course. It's like I said, this is an issue that is very close to my heart, and it's been my pleasure to bring this to my community and to a broader community of folks that need to learn more about legalization, decriminalization, defunding the police, and investing in programs like harm reduction, for example. So as we all start thinking about, we've been very supportive of Black Lives Matters and such. So these are some of the programs that we actually need in our communities, instead of criminalizing folks that are sick with, with drug abuse. So thank you so much. I posted, Steffanie, your your organization's website and your email so that folks can continue contacting you and supporting your work. I couldn't be more excited to have the Drug Policy Alliance back next week. So for those of you that watched last week and this week, we will have one more time, the Drug Policy Alliance, speaking about some other interesting topic at 6 p.m. next Wednesday. So ladies, thank you so much. I'm seeing so many hearts and like love in the comments. So thank you so much for all the work that you do. As we know, this isn't easy, and especially as you know, in our own culture, it can be quite difficult to advocate for something that is so unorthodox. So I really commend you, and let us know on the broader community here of my virtual town halls that are involved. How can we support you?
Great, thank you again.
Of course. So thank you so much, ladies. And I'm posting in the comments all of the information. And for all of you on Instagram that couldn't see it, no big deal. You can watch it on YouTube when you have a moment, and you can see Stephanie's information there. So thank you so much for joining.
Thank you.
There you go. Thank you all for watching, and I see you next Wednesday at 6 p.m. with another conversation with the Drug Policy Alliance. Tell your friends, tell everybody. We would love to see you. Have a great week, and we'll see you very soon. Bye-bye.